No problem. All right, welcome everybody. We'll get started here. So I'm Dr. Eric, founder of Physical Achievement Center, and today is an introduction to dry needling to overcome pain and disability, and I'm glad you're here. So first of all, can everybody hear me okay? And if you nod your head up and down, I'll know you can hear me okay. Great, all right. So couple things for house cleaning. Number one is we've got a couple of restrooms. You're welcome to stand up and move around. This is not the TSA on an air flight. You can get up and move around any time. There's two restrooms. One is straight across the hall, 2 doors to the right. The other one is through this doorway. It's the second door on the right. If during the presentation you need to stand and move a little bit, by all means go ahead and do so. Fair enough? Mm-hmm. Okay. The next thing is I'm going to give you a little overview of the format of the presentation. Welcome. Give you a little overview of the format. I'm going to introduce myself and the team here at Physical Achievement Center so that you have a clear idea of who is talking to you, if you will, in our perspective. And then I'm interested in hearing from you what brought you to the seminar so that I'm sure to include information that will be useful for you so that you come away with information that is useful to you. Fair enough? Then I'll go into some descriptions of dry needling. The favorite part of it at the end is always being able to see dry needling in action, and we'll do that today with a individual in the audience here. So, there we go. Before we begin, any pressing questions? Restrooms, 2 doors down to that way. And then
was a major accident.
I heard that.
Yeah.
Mm-hmm.
It's
Like a number of vehicles?
I saw multiple fire engines and ambulances.
Oh, that's not good.
Somebody's good for
Yeah, for sure. For sure. We don't always take for granted getting to places safely. It can be troublesome. So I'm going to do a little introduction on myself and the team here. I'm Dr. Eric Kaler, like I said, founder of Physical Achievement Center. This has been our mission from the start. We help people achieve greater mobility and strength for their active life without medication, drugs, and surgery, even when nothing else has worked. And introduce a little bit about myself and some other clinical team members. I've got over 30 years of clinical experience. I've had the privilege of being able to train as a fellow, as a physical therapist, and only 1% of physical therapists do that. That allows me to have access to the research and the clinical understanding of how to help people with pain conditions from head to toe in the most current way. Obviously helped a number of folks in the area. Dr. Jessica is our newest doctor of physical therapy. She's certified as a vestibular therapist, certified in dizziness and balance, and also she is currently enrolled in a fellowship program as well. Dr. Rebecca has over 10 years of clinical experience. She has a fellowship in functional science movement from the Gary Gray Institute, and she's helped a number of folks in the area. She's a certified dry needling practitioner as well. We have two physical therapist assistants. One is Gina. She's specially trained in pain relief and sports recovery massage. She's a certified spine specialist and a certified upper extremity specialist. Courtney's a physical therapist assistant. She's had over 6 years of experience in home health, and she's specially trained in pain relief and sports recovery massage, certified spine specialist, certified upper and lower body specialist as well. Slide that's missing here is Laurie Shates. She's an occupational therapist. She's a specialist in edema and lymphedema, and she does some nationwide treating. I've known her for nearly 30 years, and she's been practicing in the Oshkosh area for that. This is a picture of our staff. We've had a couple of new staff here. I'll introduce them here. So this gentleman to my right is Jake, and Jake has been with us now for about a week
I'm on my third week.
Third week. Oh my God, it's
You're
gone.
gone for one of them, to be fair.
That's true too. So yes, that's fair enough. So I've known Jake for quite a while. He helps us out at the front desk in support of our mission. And we've got somebody special in the back of the room here on loan from Texas for a little while. Erica. Erica's actually my daughter. And Erica runs marketing. She was with me at the start, like literally. We had a flip chart. Let's start a business, right? We'll talk about that in a little bit. So she's responsible for marketing, promotions, and helping with operations behind the scenes. She had some experience in the corporate world at Oshkosh Corporation before coming here and brought some great discipline to us from that perspective. So she does a great job for us. I've got some slides for this, but I'll just kind of tell the story of why the clinic started. Basically because my head wanted to explode. Because as I delved into research, as I started seeing clinical outcomes, the gap between what's available and possible for people and what's actually being discussed with individuals when they attend even physical therapy sessions or especially medical doctors sessions is pretty wide, and it's growing wider. Discussions tend to be focused on things like, well, we'll just take some more tests, we'll schedule you for some surgeries, we'll give you some more medications, and despite the fact that there are great options that are available for people that don't involve those things, or that there's more than one option and non-drug, non-surgical choices are oftentimes not discussed as fully as they should be. We believe that we should have adult conversations. Adult conversations mean we provide information and let people make their own decision. There's a concept in medicine right now called evidence-based practice. Has anybody heard of that concept? Mm-hmm. Evidence-based practice is a combination of three things. Clinical research, what does the research show? What is the expertise of the practitioner? And what is the preference of the individual? So anybody know those Venn diagrams where the circles kind of come together? When you have a culmination when all three of those match, when a patient thinks it's a good idea, when the research supports it, and you have a clinician who has clinical expertise in that area, if all three of those things line up, what do you think are the chances of a good outcome? Pretty good, right? So the challenge is if the consumer, if the patient doesn't really know all their options, can they really make the best choice? They can't, because there's a lack of information. That's why we do workshops. Of course, it's an opportunity for you to get to know us. Of course, we'd like you to come here and receive services if you so choose. But more important to me at the core is I have a responsibility to educate people on this. I absolutely really like dry needling. It's not for everybody. Some people don't want to consider it. You all are here to learn about it. It can dramatically help people, right? So I just believe in educating people and letting them have informed decisions. That's why the clinic was started. I certainly don't believe in saying silly things. And some of you might have heard silly things from people who get paid a lot of money. Those silly things might include, you're just going to have to live with it. Or it's your fill in the blank.
Age.
Seriously, we pay people over $200,000 a year to say silly things like that. It's ridiculous. So that's why the clinic was started. So to provide people other options and hope primarily. So, we have a particular bias for people when people are stuck or confused about what to do at the next step for recovery. We'll never disrespect people to say things like, what do you expect? It's your age, and you just have to live with it. And then the other thing is, ultimately that first point, we want to help people make better healthcare decisions. And our bias, we say it up front, is conservative care. That's what we do. All right. So how many of you, obviously you've heard of dry needling, how many of you maybe have experienced it in the past? Okay. How many of you experienced acupuncture? Okay, a few people. Great, we'll get into that in a minute. Dry needling, what is the definition? It's small monofilament needles injected into muscles, joints, ligaments, and near nerves in order to stimulate a healing response in painful musculoskeletal conditions. So we use the same needles as acupuncturists. Dry needling is used for a wide variety of conditions. We'll talk about some of these in a little more detail, such as lower back and neck pain, sciatica pain, shoulder impingement and rotator cuff pain, knee arthritis and knee pain, foot pain, such as plantar fasciitis. Other conditions would include tennis elbow, headaches, even migraine headaches, dizziness related to upper neck troubles. We'll talk about that a little bit. Hip pain, stiff limited scars. You'll see this is one of my favorite uses of it. It's amazing on old stiff scars. And we'll
I don't know if wrist is in there, but I know we have a few people with wrist in
wrist,
hand.
certainly, absolutely. So, first question is, we use acupuncture needles. Is it the same as acupuncture? Well, think about it like this. Anybody know what a stethoscope is, what they use to listen to your heart, right? Now, a stethoscope can be used by an RN, even a medical assistant, or it can be used by a cardiothoracic surgeon who does heart surgery, right? So the tool in this that's common is the same, but the professions are a little bit different, right? It's a little bit like that. Acupuncturists are their own distinct profession. I don't want to claim that I'm an acupuncturist. I have a high degree of respect for acupuncture. We use some of the basic information from the acupuncture world because acupuncture, of course, predates dry needling, but it's not the same. We'll talk about the differences. Acupuncture focuses on the flow of energy through the body. This energy is known as qi, and they focus on the movement of energy through the body along pathways that are known as meridians. You can think of them as kind of canals through the body. Acupuncturists are trying to bring the body more into balance. Traditional Chinese medicine is about bringing the body more into balance. There might be a sluggish movement of energy through the body, or there might be too much energy, and they're trying to balance that out. That's the intent of acupuncturists. This is dry needling versus acupuncture. I don't know if I really think of it that way, that there don't have to be, versus one another. It's just a comparison. And again, my disclosure is that I've been a consumer of both dry needling and acupuncture, and I would say rarely do the two sessions look that similar. We do dry needling in the context of a plan of care, yes.
Why is it called dry needling? Is there a
Perfect.
wet needling tool, or is it because there's no blood, or what's with the dry?
Well, we hope there's not a lot of blood. I'm not a medical provider from that standpoint, or medical doctor, probably because of that, right? No, I think so. Good question. Dry needling just means there's no injection material. So when we get injected with things, right, that would be. They don't call it wet needling, but that's traditional. Like you get injected with a shot or cortisone or something like that. Dry needling, there's no injection material. Great question, and I don't know if you're taking notes, Erica, but we should probably include that in your definition. So the other thing that I noticed is I remember I had a medical test a while ago. I don't know if anybody had the pleasure of having an EMG done, where they put a needle in muscle and then make you contract it. Let me just tell you this, there would have to be a very good reason for me to have that test done again, because it's not a pleasant test, right? But the weird thing is that I talked to a neurologist who said that he had a high percentage of patients, not like a majority of them, but a significant number of patients who would come to him for getting tested with an EMG, and they would put these needles in there, and then they would see how the muscle contracts, and they use much bigger needles, but he said a significant number of those individuals got complete pain relief afterwards. And that's kind of in the medical community how we came to discover dry needling back over 50 years ago. So, but great question. My disclosure is this. I have full respect for acupuncturists. I have full respect for physical therapists. We're two different professions. I don't think we should try to present ourselves as one or the other. This presentation is based on my clinical experience and the research that supports it. So, while I provide some conversations other professionals may want to avoid, I want to be very clear. I have respect for all healthcare professions, and my responsibility is to work with the people that are in front of me. All right. All right, so we'll get down to the kind of distinctions between dry needling and acupuncture, and then we'll talk about specific applications. So first thing, the basis for dry needling is a little bit more of a modern scientific method. We're relying on both the traditional research that has been done for a while in acupuncture, applied in modern research techniques. Acupuncture is based on traditional Chinese medicine. The purpose of dry needling is pain relief, restore flexibility, reduce inflammation, and promote better movements and better posture. The main goal of acupuncture is to restore the proper balance of qi, and that's why they're in existence along those traditional energy meridians in the body, known as meridians. Dry needling are performed by doctors of physical therapy who have 7 years of training and over 2,000 clinical hours of training at a minimum. Acupuncture at a minimum requires 2-year certificate and 600 hours in clinical training. Dry needling has what we call variable outcomes in research. Some research shows it's very helpful, others less helpful. And this is really important. The research in dry needling, we'll talk about this with specific applications. In physical therapy world, people don't come in generally and get dry needling as a standalone procedure. Typically, in the physical therapy world, in this clinic, we do hands-on work. We want to work with our hands to help muscles, joints, and nerves calm down their pain and stiffness so people can move better. So we probably all recognize that exercise can help with pain conditions. We probably can all recognize that some hands-on work can feel good at times. When we combine hands-on work along with exercise, we tend to get better results. And that's one of the reasons I think we get really good results here, because we're not afraid to do either. In addition, when we add dry needling to exercise and hands-on work, the effect becomes amplified. So when dry needling is researched in the context of that, it's improved. When needles are appropriately utilized, the research shows that you get better outcomes. Some dry needling, anybody who's had dry needling in physical therapy, oftentimes they just kind of poke at a muscle till it twitches and pull the needle out several moments. That is a new phenomenon. That is a trigger point dry needling. Traditional Chinese medicine, and what we do here is we leave needles in place. When needles are left in place and when more needles are used, we get better outcomes. So when I say that on here where it says variable outcomes, the outcomes that aren't so good is when we're just poking around a muscle and making it twitch and then pulling the needle out. It can feel good, but do you know how many times, like you have this tight muscle here or a knot or something in the back of your head, and you can rub the snot out of that? You can put some pain reliever on that, you can have a drink or two or whatever you do, and that can kind of go away for a little while, but it keeps coming back. Well, there's a reason that area keeps coming back. There's other things out of balance. And when it's just poking an angry muscle a couple of times, it might feel better for a short term, but if nothing else changes, the body's going to come back to its old thing, right? Acupuncture has variable outcomes in research. There's some really good research, even in some of our medical journals, about acupuncture. The thing about it is, the number of sessions is usually very high. In the category of 18, I've even seen some research for lower back pain, 30 sessions. And that's because they use acupuncture as a standalone treatment. They don't have the advantage of using the hands-on work and the exercise. Is acupuncture effective for chronic back pain? Yes. You might be in for 20 plus sessions, right? So, and that's an important distinction to understand we talked about. Insurance coverage for dry needling, sometimes, very rarely, essentially.
Judy Dadas.
Very rarely is acupuncture included with insurance coverage. Of course,
Yeah,
some
are you
Medicare
gonna
Advantage
pay
plans will allow for some money for some other activities, but in general, it's not generally a covered item.
I'll run your pies over later. All
So
right,
is
I
dry
think
needling
I can
effective?
start right now, we're going through this dry needling.
Here's a question.
Yes,
With the,
Yeah.
with the dry needle, is that something sometimes too where it gets good and then you come back again? You know, like sometimes physical therapy people need that too. They need it for a while and then they need it again. Does that happen with that too? That sometimes you, maybe months later, you need it again?
yes. Actually, so the question was, okay, maybe dry needling is effective for something like a knee, and then is it possible that you need a tune-up essentially? So we're actually, Dr. Jessica is doing a clinical trial right now in which they're answering that same question. So as part of her training and here at Physical Achievement Center, she's had some people come in and receive some dry needling. And some of those individuals are going to be followed for a period of, I think it's 6 months. And some individuals are going to receive that very same treatment and then have, I think it's monthly treatment through that 6 months, and to see the difference at the end. And chances are that individuals who have those tune-ups are going to do better. Absolutely. So is dry needling effective? We'll talk a little bit more about that. That depends. I use a distinction between trigger point dry needling, which is done by the majority of dry needling done in the physical therapy space is with trigger point dry needling.
And that's the one where they pull it back out, correct?
That's the one where we're physical therapists. We like certain things as physical therapists. It's in our DNA. Like, we like muscles. That's our thing. We like muscles and we like measuring movement, right? So if we can make a muscle twitch and it twitches up and down, and maybe they piston that needle up and down in there, and like, ooh, that hurts so good. And they pull it out, hey, is that still painful? No, that feels great. We're doing high fives. Challenge is that isn't very effective in the long run. So that's what I talked about trigger point dry needling. So I wish it were, right? Like, I'm sorry, it just isn't. So the research that does not support use of dry needling, and patients tell us that all the time, right? And it's the question that I ask when someone tells me, yeah, I've had dry needling before. I'll ask them, okay, tell me about that. How did you respond? What type of approach did they use? I'm not trying to sound snobby about it. I just want to know how they responded to either of the types. If they had the type of dry needling that we do, or they just had trigger point dry needling, I'll know how they responded and can help plan treatment accordingly. I call it comprehensive needling, and we'll talk about what that looks like. So trigger point dry needling, we kind of all know what a trigger point is. Like, we can't find it physiologically. That's a weird thing. Like, we can't find trigger points. It is probably a nervous system reaction causing the muscles to contract. When the nervous system is angry, it'll tell the body to do something. One thing it'll do is it'll tighten up tissues, and the trigger point is the result. And again, most people have the occurrence of a trigger point, here, or they're really stressed, their back will feel it, or they get that tension headache. Those are essentially trigger points. The muscle just becomes knotted and gummed up. It doesn't know how to relax. Comprehensive needling is where we use multiple, typically more than 4, oftentimes up to 24 needles, based on the requirement of the body part, to address the muscle, bone, joint, and in and around nerves to more comprehensively use needling. This is an example of dry needling that's done for somebody's knee. And just to give orientation to this picture, so these black things are the clips that would clip onto the needles, and these are kind of light purple that they're inserted into. This is what we call a semi-standardized knee osteoarthritis protocol that is well researched, and I'll get into it a little bit. So Dr. James Dunning, who Dr. Jessica is doing her fellowship with, he looked at all the acupuncture literature that showed a favorable result for knee osteoarthritis. And he identified all the common points that were used in all the studies that produced a positive result. And then he backtracked and said, hey, look, I know anatomically where all those points are. And then he devised this protocol that we use to this day. When this research came out, it again showed that people who get hands-on physical therapy along with exercise instruction, those people, we help those people all the time with those two things, with knee osteoarthritis. It is amazing how effective that can be. And it's one of the delights of working in this way, is that people who think they're quote unquote bone on bone, or have no other options, or don't know if they can get better without surgery, most people who have that sort of treatment, it's very effective. When you add dry needling, and in this case, the number of sessions equated to about 10 and a half on average. So when you combine those three things, you get a much better result. So when dry needling is added to that protocol, significantly less number of medications are required, oftentimes no medications, the pain scores are less, and their ability scores go up.
Is there an electric current going into those needles then?
Yes, so there's an electric current. It's microamps of current going right into the tissues for targeted healing. That's different than TENS. A lot of people have the experience of TENS, especially those that have had chiropractic care. TENS means stimulation of the skin. That does not enter into the tissues. This is right in the tissues. So, told you a little bit about how this particular protocol was designed, and others are designed along that lines too. And as we're seeing those clinical trials used, we get an opportunity to validate the improvement that we get with dry needling. So some distinctions between trigger point and comprehensive dry needling is the number of needles used. Generally trigger point dry needling, 1 to 3, maybe 4 needles. Comprehensive, typically 9 to 15, maybe even as high as 20, 24. Electrical stimulation is typically not used with dry needling. It is almost always used with comprehensive dry needling. It doesn't have to be used. Obviously, if someone has like a pacemaker or some other electrical implant, or is really sensitive, we won't use that, but most of the time we use electrical stimulation with it because it enhances the effect. Needle manipulation, typically in and out for the trigger point dry needling in order to cause that muscle twitch and wait until exhaustion. Comprehensive dry needling may include twitch response, but generally once the needles are in place, we leave them in place for a while. Needles left in place, seconds to a couple minutes for trigger point dry needling. We typically leave our needles in for 10 plus minutes. Typically we're aiming for that 15 to 30 minutes. Not a lot of benefit after 30 minutes. Early on, as someone's first gaining exposure to it, particularly if their pain level is a little high or they're a little sensitive, we might leave them in place and have fewer needles until they kind of get used to it. Bone, joint, and cartilage stimulation, trigger point dry needling, sometimes we'll do that. With comprehensive dry needling, we'll absolutely stimulate the cartilage tissue and the bone tissue. That knee protocol, we're trying to get down to help stimulate the bone tissue to stimulate healing and recovery. And why is there variability in the approaches? Basically, it comes down to two reasons. Number one is because different clinicians are trained differently. And the reason so many clinicians are trained with trigger point dry needling is keep in mind, it only takes minutes. Comprehensive dry needling, it takes minutes to set up. It takes minutes to take them off. So clinical training is part of it, convenience, and to please the insurance companies. So dry needling is not covered by insurance generally. So oftentimes clinicians will attempt to just, hey, we'll just bury that charge under another code or with time. We don't do that. My question that I ask myself when we're working with patients, what's in the best interest of this person? If comprehensive dry needling is an option that's appropriate, I'll let them know. Hey, I think dry needling would be really effective for you. By the way, your insurance company probably doesn't cover it, or I know it doesn't cover it, and it's this cost. How would you like to proceed? Like, let's have an adult conversation, right? And if you don't choose to have it, that's great, but you should know what the best option is to move forward. So, this is that little Venn diagram here of clinical expertise, evidence, and patient preference. I actually think that should have the patient preference at the top because the patient drives everything, right? My patients are my boss, right? I'm a consultant, essentially. So I don't work for insurance companies, I work for my patients. Oh, I love this one. Go show them who's the boss. I like that. Those little memes are fun to look at. So other conditions that dry needling has research support for is knee osteoarthritis, like I mentioned. I'm really excited about that, especially when combined with hands-on joint mobilization techniques and specific exercise protocol. That's another illustration of that. It's actually probably the same knee, just a different angle. Chronic lower back pain can be very effective. Acute lower back pain as well. With chronic lower back pain, the person needs lots of needles. Fortunately, the backside isn't overly sensitive, so it has a good tolerance for lots of needles. We like to get those needles deep into those tissues because anybody's had back pain, those muscles really get tight. You got to get down there deep. Yes.
What about if somebody's had back surgery before that? Number of years before.
The needles don't enter in, so certainly the post-surgically. So within 3 to 4 months of a surgery, guess what I'm going to ask about? Whether it's okay to do dry needling for post-acute back surgery.
Even if it's a number of years?
I'm going to ask the surgeon if that's okay.
Okay.
Right? Because if there's a problem with that, who are they going to blame? Right? But months and years out, absolutely. The needles don't enter into the nerve tissue of the spinal cord. There's enough specificity and enough layers of that, but it's very effective for pain relief following. Presumably, if someone's still having pain after a back surgery, they call it a failed back surgery. So that's an example of some needles, and that's kind of showing, and this might be what we see today in today's demonstration, but needles are kind of along the center of the spine, and then maybe needles a little bit to the side to capture those spinal muscles in the back, the flank muscles. Shoulder pain related to impingement and arthritis. Need needles, and anytime you work with the shoulders. Generally shoulders need a couple things. They need more flexibility, and they need more muscle power in their rotator cuff muscles. So any intervention we do with shoulders generally includes that. Because if you don't, you're just making it feel better and slapping a Band-Aid on it. Those arms got to reach overhead, and those arms have to be capable of managing some weight. Yes, do you have a question?
Rotator cuff is gone.
Rotator cuff is gone?
Yeah.
Okay, well, so I do a lot of 5-minute miracles, right?
Okay.
In terms of in these presentations, we call it a 5-minute miracle where we have a patient demonstration, and the few times it hasn't worked out, that person had a massive rotator cuff tear. Right? So
I tore mine all the way through, so.
yeah, so there's only so much you can do, right, in terms of that. However, if someone has residual pain related to their shoulder problem, dry needling is a really nice addition, particularly because sometimes that shoulder is fed by an angry neck or upper back. So those areas can be calmed down, yes.
So if a person wants to have this done, would you want the x-rays from the shoulders?
We don't generally need those. They may be handy if you're bringing them in, but we don't absolutely need them. In an ideal world, we do physical exam, patient history, always hearing what the patient has to report, and you'll see this today. We'll do a bit of a physical examination so that we have a better idea of what's going on, and then we can ask questions about tests and maybe look at them if necessary. Oh, that's an example of, so that person's lying on his right side. Those needles here are in the back rotator cuff muscles, And the needle here is in his deltoid. This needle is a little bit lower. We oftentimes try to get into that joint capsule of that shoulder as well, which can be really effective for those stiff, painful shoulders. Tension, migraine, and neck-induced headaches, very effective for. So there's a set of muscles, and anybody who has headaches probably knows this, right at the base of your head. There's some muscles, the one you rub on to try to relieve your headache. Literally when those become tight and taut, they will irritate a nerve that can shoot pain up the back of the head and even to the front of the head. Additionally, tightness in those muscles and stiffness in the upper neck can cause dizziness. There's a term called cervicogenic dizziness, which is neck-caused dizziness. So when people have dizziness that we can't attribute to a immediate medical crisis problem like a stroke or a heart attack, one of the things we're going to want to do is assess that upper neck, both in the muscles and the joints, to see if there's any problem there. The issue is there's nerves that are coming from those areas in the upper neck, and they come to a kind of a transfer station where the nerves are en route to the brain, and that transfer station is right next to the transfer station for the signals coming from the inner ear and the balance centers. So oftentimes when there's a problem in the neck region, there will be a misfiring of the nerves to make it feel like we're dizzy. It's a real thing, but you have to correct the neck problem, and oftentimes the dizziness and or headaches that come along with that problem goes away pretty abruptly. Oftentimes what people will say, we'll drop a needle in there and they'll be, oh yeah, that's it. And that's a good sign that we're in the right place. This is showing placement of needles in a couple key areas, and I'm sorry that may not be as clear of an illustration as I'd like, but that's basically needles right underneath the noggin of the head, maybe a little bit to the side. And we're going down to the bone of the head. We're not going into the spinal cord. That would not be a good drug healing event. And we'd have to get very deep into the tissues there. We'd have to be really off target to do that. Jake, would you mind grabbing that spinal model that's in the back room? It's in the back gym, hanging on the wall, or ask somebody where that is. There's developing research that supports, but certainly we see it in the clinic all the time, that if I've got a patient who's dizzy, it could be an inner ear problem, it could be some sort of balance problem, we're always screening the neck to make sure that that's not included, because if you don't include that, you're missing out on opportunities for improvement. Tennis elbow, some research is showing it's equal to cortisone injections for pain relief. This is a protocol of the tennis elbow, basically the muscles that cock the wrist back, and the muscle that you give somebody the bird. You basically put those needles in along through there, put a little electrical stimulation. People love that. This one hurts so good, but it's really effective. So on the spine model here, to get back to the neck condition, so we like to have needles right where those muscles insert right into that bone, and then a little bit to the side where they insert into that bone, and then maybe even near the vertebrae where those muscles connect to. So anytime you can get this area calmed down, it feels really good generally. Plantar fasciitis, heel and foot pain. I've seen incredible results with this. Anybody got sensitive feet? Right? Like I do too.
My son has that,
Yeah,
and he's in pain all the time.
sure. So the bottom of the feet are very painful. People who are at a point where they're willing to take a look at dry needling from the bottom of their feet, they're desperate. Like I didn't have foot pain and I had to get the bottom of my foot needle. Like I don't want that. But of course, I see enough positive results from it for people who do have plantar fasciitis that it's certainly a strong recommendation, right? So
Well, I'm gonna try and talk to him, but he hates needles.
We have other approaches too, so he doesn't have to succumb to needle. We have other approaches that are very effective. So this is a protocol for needling, that's needling the ankle and foot. And some of those are along nerves that are in the ankle and foot, some are obviously in the bottom of the foot. But people who have foot pain, nothing can compare to the amount of pain that they can experience. with
How
blunt
many
fissures.
times would you have to go through it?
Well, each case is on its own, but more than once, less than 10 times probably. Now there's no so when I say research, what I mean is something that's published in a medical journal, right? Something that doesn't have necessarily, at least I haven't seen that research, that needling is really effective is stiff scars from old surgeries. We're gonna talk about that's why it's really effective. It's really a cool way to get that. Nerve pain related to sciatica, certainly for lower back pain, research is there. Certainly nerve pain down the leg, it can be helpful for as well. The challenge is, just like I mentioned, right, like some of these conditions, they need the hands-on work and the exercise in addition to the pain relief, so it's hard to find standalone treatment that's effective.
Is the scar tissue part of what would tighten up a hip joint after a hip replacement? Is that?
It
part?
could be, yeah.
Okay.
We had an individual who we did some of that. She had beautiful replacements, they looked good on x-ray, but the scar was just really tight and irritable, so we worked needles to loosen up that scar tissue. Temporal TMJ joint, jaw joint, tendon issues such as the Achilles tendonitis in the back of the foot, carpal tunnel, which is wrist pain, if you will. And that's an illustration of a scar. Talk about sciatica as the second picture. And then in the TMJ area, in and around that area. And then this is a really good program for people that have pain in the ankle and foot. Regrettably, sometimes the recommended procedure for people that have foot pain or tendon pain around their foot is they put them in a boot, a walking boot, to immobilize it for a period of time. That doesn't usually turn out so good. Right? Anytime you immobilize an area totally, unless it's a broken bone, it doesn't turn out well. And then there's needling near nerves for carpal tunnel syndrome. So, why is dry needling effective, right? So some people believe it's just because of placebo. So placebo is the patient belief that it's going to be helpful, helps influence the outcome. Okay. That's different than, or it's kind of related to positive expectation. Like if someone comes to me and they're like, nope, needling's not gonna work for me. Do you think needling's gonna work for that person? No. If they say to me, oh, I'm glad I found you, you're dry needling, that's perfect. I think dry needling is gonna be perfect for my neck. And I do dry needling, what do you think of the chances of that person getting better? Pretty high, right? So there is some positive expectation, but it isn't all placebo, right? Jake, if you wouldn't mind hitting that door. So placebo may play a role in it. Anytime you add another treatment to something, you tend to get a little bit better help because perhaps people think, hey, I'm getting better care. That one, yeah. Just a radio across the way. I've got like dad ears, crazy dad ears. Like I can hear stuff around the corner, and so thanks, Jake. Blood flow will increase when we do dry needling in that area. That always helps stimulate healing, especially when the electrical stimulation is used. When dry needling is done on the cartilage and bone tissue, it can actually stimulate scarring over and thickening of that tissue. We definitely want to use that in the case of knee osteoarthritis and some other conditions. So the middle diagram is just an illustration of the arterioles and venules coming from the veins. You get increased vasodilation, opening up those blood vessels to bring new blood in. And you can stimulate the cartilage tissue and periosteal bone. In this instance, if you've got heel spur pain, that can decrease sensitivity in the area quite a lot. It increases the body's happy chemicals, endorphins, enkephalins, opioids, cannabinoids. Yeah, cannabinoids. The body has its own cannabinoid system, so when we do really good hands-on work and when we do needling, that increases the number of, or the increases the body's production of its own pain relieving chemicals. It reduces inflammation in that body region as well. Anytime you can lower inflammation, that helps with pain relief, helps with muscle recovery, and decreases some of the body's SAD chemicals, the cortisol, stress activity centers, and can decrease that stress response. It can reduce the level of nerve irritation. So I think of the nervous system kind of in three general areas, kind of in the central nervous system or the brain, kind of in the nerve centers that go up and down from the brain to the vertebral levels, and then the nerve centers that kind of go in and around that area. So let's say someone's got a jacked up shoulder, right? So you can have, and it's been around for a while, there could be increased aggravation of the nerves in and around the shoulder area. There could be increased aggravation of the communication to and from the spinal cord that correspond to that nerve area. And the brain itself can have nerves that are hypersensitive. That kind of makes sense when you hear about it, right? It's kind of, they become hair triggered. Dry needling can help decrease the level of hair triggeredness in the nervous system at all levels, both of the region of the area that's irritated, in the spinal cord, and in the central nervous system. And there's this chemical called acetylcholine. That is a chemical that's in muscles. When a muscle is taut all the time, there's an increase or entrapment of acetylcholine that the body can't release. That acetylcholine keeps the muscle contracted partially, and then the muscle gets more aggravated and more contracted, so it starts to cycle on itself. The use of dry needling with electrical stimulation causes that muscle to contract enough times to release that tension there much more dramatically than even if we do direct tissue work. Like for tight, taut muscles, we can do deep tissue work and we do deep muscle work. Dry needling can usually take the place of anywhere from 3 to 5 sessions of deep muscle work because it does such a dramatic job of releasing muscle tension. When we leave the needles in place, we cycle that either 2 or 4 cycles per second. So you can imagine if someone's on there 15 times, I don't know the math there, that's a lot of muscle contractions, but there's a lot of opportunities for the body to release those chemicals that trap that muscle into remaining active. And then it stretches the connective tissue directly when it comes to scars. So this illustration at the top would be showing some of the nerves that are associated with tension type headaches, some of the nerves that also would be associated with cervicogenic dizziness. And that illustration at the bottom I think is a really nice illustration. So just to give you orientation, that thing that looks like a nail coming down, that would be the needle. So the needle comes down in the tissue. Tissues have these structures in them. And when we work with scar tissue, we do a twisting of the needle. And literally the fibrils that are in the tissues, kind of like the threads of yarn in a shirt, become entwined in that needle. They become entwined so much that if we needle in such a way that it may actually be very difficult to pull that up. So we are getting directly into the tissues. When we do other types of tissue work, when we press the tissue down and then shear it right to left, like we do in deep massage, or when we take a cup and pull that tissue up, that's a kind of a mechanical deformation in 2 dimensions. When we do it with a needle, it's right in that area. It's very effective.
Do you do cupping as well?
Yes, we do cupping, yeah. So, summary for dry needling to be effective, we need a few needles, more than a few, oftentimes even up to 24. Sessions, it depends. Everybody asks me, well, how many do I need? Well, usually people need more than one, right? Particularly if the condition's been around for a while. We do this thing where we offer a discount for packages of 4. That's just because someone says, well, how many do I need? Well, in order to try dry needling, and I usually say, you really need 4 sessions. Like, you gotta be fair with this, right? But 4 to really understand how effective it's going to be for you. It's rare that I've needled more than 10 in somebody, but it's certainly possible. Manual manipulation of needles if needed, combined with electrical stimulation unless there's a reason not to. And Yeah, so that's discussion about dry needling. That's a lot of information, and when my mouth is dry, I know I've talked too long. So, yes,
Is it usually like you check over everything with somebody before they get into the dry needles? So you have to be, kind of checked through the therapist, physical therapist.
yes. So dry needling here is done, like I say, people don't come off the street and say, hey, I'd like a dry needling session for my right biceps. We'd be like, okay, you wanna try dry needling? That's awesome. Let's do an assessment and see if that's appropriate for you or not. And then we assess that. We actually, unless, in a rare instance, would someone come off the street, just receive dry needling only. They might if they're an athlete and then we've known them, or they come in specifically, hey, look, and then we already would know them. So, does that answer your question? Okay, perfect.
Do you typically work on the spot that is the issue, or are there certain situations where you might be working on a foot to fix something in another part of the body? Or is it typically on the spot that you're concerned with?
So the needles will generally go on the area that's painful, and we'll either treat with another approach, or we'll have some understanding, is there something else feeding it? Like here's an example, like a shoulder pain. Anytime someone comes with shoulder pain, I'm thinking to myself, yeah, their shoulder might have some issues, but they might have neck irritation that's feeding that irritation. They could have a condition called T4, which is that area between the shoulder blades, which is an unrecognized condition contributing to that. But usually, like the couple things that I've learned in my career that become clearer and clearer, that is, if you just treat where the yowie is, your results aren't that good. Your results get a lot better when you start to think of all the contributing factors that bring that yowie to be. So, great questions.
Is there anything you can do about tremors? It's not pain related, but I think it's nerve related.
I mean, certainly I don't think I would say that tremors would be something that I would, in my understanding of dry needling, would use. I don't know if there's anything in the acupuncture world I think would be a worthwhile consideration for sure. The one thing I did see in research that's helpful is, it doesn't have to be vigorous, but strength training. Engaging those muscles, whole body strength training.
Okay.
I've seen good research for. So if someone's asking me, what would I recommend for tremors? Strength training routine.
Okay.
So, great question.
Is there anything you could do, like, with vagus nerve, causing dizziness? Like, I don't know, I think that's part of my dizzy problem. I mean, I have orthostatic hypotension, but like, I've been told and watched, videos on neck issues causing vagal nerve problems.
So there's a muscle here, the sternocleidomastoid. I mean, if muscles in and around the neck need addressing, we might needle that and see what effect that has on your condition. Right?
A little bit.
We're not needling near that nerve, of course.
Right, no.
Yeah. Good question.
Do you treat several areas at the same time, or do you have to have special appointments for each area?
That's a good question. So what usually happens to us, someone comes to us and they say, I want to get, let's say, my shoulder treated. And then they start getting treated and we're like, well, we probably, we will usually take a look at the upper back and neck and see what contribution that's making. And then they start feeling a bit better and they're like, yeah, I didn't tell you before, but my knee kind of bothers some. Can we do that too? And I'm like, well, and then we just kind of decide, okay, in this session, can we do enough good in both areas? But I treat the whole body. Like, you don't move as a shoulder, right? So sometimes we can include multiple areas, and sometimes an area needs a lot of attention. I can think of one gentleman who came to us, both shoulders are bad, both knees are bad. I'm like, dude, you're a big guy. These are difficult things to overcome. Like, we can do it, but we got to divide that into two
You
sessions.
needed knitting needles.
What's that?
You needed knitting needles.
He had a lot of needles in him, for sure. So if you wouldn't mind, if you get a kneeling massage chair here and wheel the cart around. So we're welcome to ask any other questions here. I'm going to get, as they say in the South, I'm fixing to do some dry needling here pretty soon. So other questions? And maybe some towels from that cabinet back there, some like larger towels.
Do you ever work with chiropractors? For instance, I've had some good chiropractors that put bones back into position and to keep them there and what to do. They have a lot of, and I just wondered if you ever work, like after you have a chiropractic adjustment of a bone, do you ever work on that area to heal it? Have you ever done that?
So I think I know where you're going. So not to that level. Like a fair number of our patients have worked with their chiropractor on a regular or episodic basis. We got no problem with that. There are times when I'd say, hey, look, you know what? If we're introducing dry needling for the first day, I don't mind if you see your chiropractor, but maybe not the same day. Because if you have a good outcome or an outcome that's not so favorable, we want to narrow it down to one thing that was different so we can understand your response to it. But it wouldn't be a horrible practice. I mean, ahead of treatments, so I'm not a chiropractor, I have a healthy respect for them. That was my introduction to hands-on work. And one of the first people I talked to before I decided to open up a practice was a chiropractor, or is a chiropractor, he's a retired chiropractor in town. So I have a healthy respect for them, but we work with joints as well, mobilization and manipulation of those joints, and then afterwards doing dry needling. That's a beautiful combination. And again, I think the secret, I don't think it's a secret, it's just what we do is we want that joint to be happy. We want those muscles to be happy. We want them to be engaged in some sort of exercise that relieve pain, increase flexibility, eventually promoting strength, because ultimately we're not just after pain relief, we want to get your life back. Like a lot of people think, oh, it's a pain, it's a pain, it's a pain, but because of the pain, you haven't been able to sleep perhaps, you haven't been able to manage your house like the way you want, you can't participate with your friends and family like you would like, you can't work like you'd like, you can't do your sports or recreational activities like you like, traveling you got to think about, so we want people to be strong and move well. So I think we need an all systems approach to it. So very good question.